Michigan is in the process of settling a lawsuit over mental health care. The lawsuit was filed in 2018 by families who say their children didn't receive proper care for serious mental health issues. The goal of the lawsuit is to help kids stay with their families, get the care they need, and grow into adults who can stay and contribute in their communities. Governor Gretchen Whitmer is also stepping in by allocating $91 million of her 2020 executive budget plan to improve behavioral health service supports. Kyle Williams, the Director of Litigation at Disability Rights Michigan and one of the lead attorneys in the lawsuit, has this to say about Whitmer's plan.
I think that appropriating $91 million is an excellent start to trying to have some real change to this system that's going to have a positive impact on those folks that are most vulnerable. And so I would say that's definitely good to appropriate money towards the system, to try and improve that system and to try and target it towards home and community-based services.
Remember Jay Gross? He's not a part of this lawsuit, but he knows the struggle well. He's the Michigan father whose video went viral while he was trying to get his son inpatient psychiatric care. We brought him back into the conversation to see what he had to say about the lawsuit and the money from the state.
I wonder if it's a Band-Aid. I don't know enough about it, I just don't know enough about it. But I'm like, if it's gotten the families what they need because they were buried in healthcare costs for their kid going through this, it paid those bills, and some of this money goes in for the right purposes for mental health, that's a good thing.
Taking a closer look at Governor Whitmer's plan, it would seek to make sure Michigan children who are enrolled in Medicaid or are part of the child welfare system have better access to those services. It would also invest $26.5 million to establish 14 certified community behavioral health clinics, among other things. So our conversation continues around the lack of inpatient psychiatric and behavioral health services for teens and kids. But this time we'll talk solutions and explain what's in the works right now.
So about 4 years ago, 2017, a number of parties, the Hospital Association, our association, the State Department of Health and Human Services, clients, patients, physicians said, it feels like there's a lack of psychiatric beds for adults and kids.
In 2017, the Michigan Department of Health and Human Services launched an initiative called the Michigan Inpatient Psychiatric and Mission Discussion Work Group, or Mypad. Their mission was to investigate the problem with inpatient psychiatric services and offer some recommendations.
The report was issued then in 2018, calling for a number of changes. Better staff training, beds scattered throughout the communities, rural as well as urban, better payment sources, a number of alternatives.
Bob Sheehan is the CEO for the Community Mental Health Association of Michigan. He and other experts we spoke to say many of the report's recommendations are no-brainers. The first one, crisis stabilization units, or CSUs. A CSU is basically a place where a person can get short-term mental health care and get back on track.
Sometimes time is a benefit in psychiatric care. If I'm in crisis, or if I've used medications that cause me, or drugs that cause me to be in crisis, or if the stressors that I'm in cause that, being in a non-stress setting those symptoms can abate.
The report recommends having CSUs available 24/7.
There are some what we call crisis stabilization unit lookalikes already. There's about 6 of them in the state. They aren't certified by the state to hold people for more than 23.5 hours though. There are many steps to be done to open those. They have to finance them, they have to certify them, they have to agree on what the basic structure has to be. Most of us think we know what it is, but different people have different views, so that'll be worked out in the months ahead.
Sheehan says those 6 sites also have to be certified, and that could take about a year. State health officials tell me those certifications are in the works. Number 2, addressing the shortage of psychiatrists.
There's a lack of psychiatric staffing across the country. There are insufficient adult and child psychiatrists, and you have to have a psychiatrist to run an inpatient unit. And if you can't find one, and you can't use telemedicine for some of those services, so you can't have a psychiatrists in another location calling in or videoing in for a lot of inpatient work.
There are a few theories as to why there's a shortage.
Psychiatrists aren't paid poorly compared to, other white-collar jobs or blue-collar jobs, but compared to other specialties, they're one of the lowest paid. So that drives people away.
One of the report's recommendation is that the state health department could offer loan repayments as a way to encourage people to get into the field.
The psychiatric workforce problem is a bit deeper. The pipeline is long. It starts with med school, maybe undergrad, and then med school and residency, and keeping people around for loan repayment. So you got to start early in that pipeline. So that's a couple of years away.
Number 3, more beds in community hospitals. The report recommends community hospitals develop the capability to assess mental health patients and begin treatment while they are waiting for inpatient placement. Harmony Gould is the Vice President of Hospital and Residential Services at Pine Rest Christian Mental Health Services. She explains the need to reach people who are struggling as early as possible.
This is a really big system, and matching people with what they need, especially if it doesn't exist, it really creates all these unintended consequences. So it's the making sure that in our continuum, we have the right services. And certainly the preference is to reach people earlier so they don't need an intervention like going to a hospital or even a crisis stabilization unit. But if they're able to access partial hospitalization or the right outpatient services, the right group services to meet their needs.
We learned from Jay Gross's viral video that his son was in the Gratiot Community Hospital in Alma for 12 days, waiting for an inpatient bed to open up for him. What if those 12 days had been spent beginning the treatment process?
We're pushing, like the hospitals are too, for more beds in community hospitals across the state. One of the ways to do that is to have mental health wards, kids wards in med-surg hospitals. Because the days of the freestanding psychiatric bed in every community is gone.
And lastly, number 4, create a registry to easily identify bed vacancies. The report suggests the state health department create a web-based resource that would look for available beds by gender, age, and diagnosis.
It's actually being developed now. It's called a bed registry. Yeah, it would allow you to look up, I have a 14-year-old female who's got this condition. Are there any beds that can take that 14-year-old female? As opposed to making 9 phone calls.
The State Department of Health and Human Services says development of this resource has begun, but there's no word on how long it could take. They sent me a statement saying, in part, quote, MDHHS is strongly committed to increasing the access to mental health services for children in Michigan. It is important that our children grow up healthy, both physically and mentally. To be clear, there are many more recommendations in the Mypad report, but let's bring this full circle. Let's go back to Kyle Williams, the attorney, and Jay Gross, the Michigan father, fighting for resources for his son. How do you feel? Do you feel like we're moving forward? Do you feel like we're trying to move forward? What are your thoughts?
In this situation, I think it gives us hope, because anything positive to go down this, to me, is even if it's only a half a step or a quarter step, even a lean forward, you got to keep moving forward.
Williams agrees, but also hopes that the state will look at more community-based treatment plans so they can limit inpatient services.
You can resolve that problem where there aren't any psych beds by doing a good job in the community and helping those kids stay there, even if there is a crisis, because you can address crises in the community. And that's one of the primary goals of the lawsuit.
MDHHS has communicated a target date for the development of a plan by April 2021 to the legislature. But those goals will take time to achieve before making them a reality for the public. If you missed part 1 of this conversation or you want to rewatch part 2, visit our website, fox47news.com. Reporting in Lansing, I'm Tiana Jenkins.